Thank you.
Thank you very much. And now let me go to the Canadian Psychiatric Association, Dr. Philip Thibault.
Thank you, Mr. Chairman, Senators, and good afternoon. Just as a further introduction, I am a psychiatrist and mental health researcher from Nova Scotia. I'm the director of the Nova Scotia Early Psychosis Program at the Nova Scotia Health Authority, as well as professor and the Dr. Paul Janssen Chair in Psychotic Disorders, which is an endowed research chair position at Dalhousie University. I'm also currently the president of the Canadian Consortium for Early Intervention in Psychosis, but today I'm pleased to be here today on behalf of the Canadian Psychiatric Association, which is the voluntary professional association for Canada's 4,600 psychiatrists and over 900 psychiatric residents. And important to this discussion today, the CPA is an evidence-based profession. It's advocating for policies that allow for the best possible mental wellness for Canadians. I would like to begin by thanking you on behalf of the CPA for the care and diligence this committee has exercised in fulfilling its duty to address many of the health issues contained in Bill C-45. The legalization of cannabis is indeed a complex undertaking involving a multitude of social, medical, economic, and legal considerations. With clinical research colleagues, I was privileged to write the CPA position statement entitled Implications of Cannabis Legalization on Youth and Young Adults. The CPA stands by its original position on the subject and strongly urges the committee to consider the mental health implications of cannabis consumption on youth and young adults in its review of Bill C-45. Our 2017 position statement on the issue is supported and endorsed by the Canadian Academy of Child and Adolescent Psychiatry, the Canadian Academy of Geriatric Psychiatry, the Canadian Academy of Psychiatry and the Law, and the Canadian Academy of Psychosomatic Medicine. As you've heard and it's been mentioned before, cannabis is the most commonly used currently illicit drug among Canadian youth, and Canadian youth are among the top users of cannabis in the developed world. While there are variations by jurisdictions, approximately 22% of youth aged 15 to 19 and 26% of young adults between 20 and 24 report using cannabis during the past year. However, in this group, 20 to 30% report using daily or almost daily. Bill C-45 will make 18 the legal age of use, purchase, and possession of cannabis. While individual provinces have been allowed to set higher age limits, most are saying age restrictions for cannabis use will correspond to those already set for alcohol. Canadian psychiatrists know that there is a strong evidence base showing that early and regular cannabis use can affect aspects of cognition, such as memory, attention, the ability to process thoughts and experiences. This, in turn, though, has implications on educational and occupational outcomes. There is also substantial evidence for an association between early and regular use and the development of schizophrenia and other psychosis. And there is currently moderate evidence of an association with depression, anxiety, bipolar disorder, as well as substance use disorders. So research has shown, and this has been brought up as well within this committee, that the human brain continues to develop until we're about in the mid-20s, and you've often heard the age of 25 being used, but as we say, the mid-20s. And this process includes that reorganization, refinements, and functional improvements. It is driven by changes in the brain gray matter due to synaptic pruning, which is that elimination of underutilized or unnecessary neural connections, as well as changes in white matter due to myelination, which allows for that fine-tuning of connections between different parts of the brain. Our human endogenous endocannabinoid system plays a role in this brain maturation, and therefore external cannabinoids can affect this process directly in a negative way. It is for these reasons that the CPA continues to maintain that Canadians should not be legally allowed to use cannabis until the age of 21, and that legislation should restrict the quantity and potency of the drug until they are 25. Cannabis with high tetrahydrocannabinol, or THC, content can result in significantly worse mental health and cognitive outcomes. And we have seen the THC content of cannabis rise over the years from about 1.5% in the 1970s 3% in the 1980s, 14% by 2010, with current estimates today of 28% or higher. An increase in the incidence of psychosis onset is attributable to the rise in THC in regions where high-potency cannabis is more prevalent. We are pleased that Bill C-45 includes a commitment to public mental health education targeting youth and young adults around the effects early cannabis use can have on brain development. The CPA wants to underline its willingness to work with the government on critical components of the legislation related to research, public education, and harm reduction. In summary, the CPA recommends, from an evidence-based lens, that due to critical brain maturational processes in youth and young adults that can be affected by cannabis, in addition to the associations between early and regular cannabis use and negative mental and cognitive health outcomes, that Canadians should not be legally allowed to use cannabis until the age of 21. As well, legislation should restrict the quantity and the potency of cannabis for those under the age of 25. Cannabis with high THC content does have significantly worse mental health outcomes. Legislation should also address that need for public education targeting and resonating with youth and young adults around the effects early and regular cannabis use can have on brain development and subsequent cognitive and mental health. And government should consider funding significant further research to better understand the impacts of cannabis on mental health, as well as its legalization on the mental health of Canadians. Support should be expanded for prevention, early identification, and importantly, cannabis cessation treatments within the framework of mental health and addictions. And as we've heard previously, legislation should be explicit and prudent with its advertising and marketing guidelines, including those clear markings of THC content, as well as consistent public health warning messaging. Thank you for the opportunity to appear before the committee on this important issue, and of course I'd be happy to answer any questions following.